Today I shall be taking a lecture on mental health evaluation in everyday's life. After I finish my lecture, you shall be able to know about mental health, learn how to take care of your mental health and others' mental health as well. You will also identify mental health problems which affect in our everyday life and analyze the facts and figures of mental health problem. Let me give you an introduction to mental health in everyday life. Mental health affects us all. How we think and feel about ourselves and our lives impacts on our behavior and how we cope in tough times. It affects our ability to make the most of the opportunities that comes our way and play a full part amongst our family, workplace, community and friends. It's also closely linked with our physical health, whether we call it well-being, emotional welfare or mental health. It's the key to live a fulfilling life. According to World Health Organization, WHO, mental health includes subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellect and emotional potential, among others. WHO further states that the well-being of an individual is encompassed in the realization of their abilities, coping with normal stresses of life, productive work, and contribution to their community. However, cultural differences, subjective assessments, and competing professional theories all affect how mental health is actually defined. Let me define mental health for you. Mental health is a psychological state of being mentally well, that is, free from any kind of mental illness in which an individual is able to use his or her cognitive skills and emotional capacities to meet the ordinary demands of everyday life to function normally in a social setting. It can be interpreted in other words that a mentally well being is that person is able to function at a satisfactory level of emotional and behavioral adjustment to cope with day-to-day hassles, normal stresses of life, enjoy life and create a balance between life activities and efforts to achieve psychological resilience. Being mentally healthy doesn't just mean that one doesn't have a mental health problem. If one is in good mental health, he or she can make most of his or her potential, cope with life, play a full part in one's family, workplace, community, and among friends. Mental health is everyone's business. We all have times when we feel down or stressed or frightened. Most of the times, those feelings pass, but sometimes they develop into a more serious problem, and that could happen to any one of us. Everyone is different. One may bounce back from a setback, while someone else may feel weighed down by it for a very long period of time. One's mental health doesn't stay same always. It can change as circumstances change and as you move through different stages of your life. There's a stigma attached to mental health problems. This means that people feel uncomfortable about them and don't want to talk about their health problems, especially the mental health problems. Many people don't even feel comfortable talking about their feelings. but it's healthy to know and say how we are feeling. What exactly are mental health problems? We have mental health problems in everyday life. They range from worries we all experience as part of everyday life to serious long term conditions. The majority of people who experience mental health problems can get over them and learn to live with them, especially if they get help early. Mental health problems are usually classified and defined to enable professionals to refer people for appropriate care and treatment. But some diagnoses are very controversial, and there is much concern in the mental health field that people are too often treated according to being described or being labeled. This can have a profound effect on the quality of life of the person. Nevertheless, diagnosis remains the most usual way of dividing and classifying symptoms into groups. Most mental health symptoms have traditionally been divided into groups called either the neurotic or the psychotic symptoms. Neurotic covers those symptoms which can be regarded as severe forms of normal emotional experiences such as depression, anxiety, or panic. Neuroses are now more frequently called common mental health problems. Now, less common are the psychotic symptoms, which interfere with person's perception of reality and may include hallucinations, such as seeing, hearing, or smelling or feeling things that no one else does. Mental health problems affect the way you think, feel, and behave. They are problems that can be diagnosed by a doctor, but they are not personal weaknesses. Mental health problems are very common, and about a quarter of the population experiences some kind of mental health problem in any 1 year. Anxiety and depression are the most common problems, with around 1 in 10 people affected at any time. Anxiety and depression can be severe, long lasting, and have a big impact on people's ability to get on with life. Out of 100, 1 or 2 people experience a severe mental illness such as bipolar disorder or schizophrenia and have periods when they lose touch with reality. People who are affected may hear voices, they may see things that no one else sees, hold unusual or irrational beliefs, feel unrealistic, powerful, or read particular meanings into everyday events. Although certain symptoms are common in specific mental health problems, no two people behave exactly the same way when they are unwell. Many people who live with the mental health problem or are developing one try to keep their feelings hidden because they are afraid of the other person's reaction. And many people feel troubled without having a diagnosed or diagnosable mental health problem, although that doesn't mean they aren't struggling to cope with daily life. Let me share with you some mental health statistics. The studies done in UK to collect the mental health statistical data explain the following main mental health problems prevailing in the country. Number 1, mixed anxiety and depression are most common mental health disorders in Britain. About 10% of children have a mental health problem at any one time. Depression affects 1 out of 5 older people in the country. Only 1 of 10 prisoners has no mental disorder. More than 5,700 people in the UK died by suicide in 2010. Now, this information has been got from Samaritan's Information Resource Pack 2012. UK has one of the highest rates of self-harm in Europe at 400 per 1 lakh population. Mental health continues to be treated almost like afterthought. There is a severe shortage of mental health professionals and facilities in India. In India, 5% of population suffers from common mental health disorders such as depression and anxiety, as per studies conducted by the National Commission on Macroeconomics and Health in 2005. In AIMS, there is one psychiatrist available for 4 lakh Indians. There are 4,000 psychiatrists, 1,000 psychologists and 3,000 social workers available for the whole country. Brain drain is the reason for shortage in availability of mental health facilitators in India. There are more Indian psychologists in the USA and UK as compared to India. Let me talk to you about the community mental health services that will lessen social exclusion. In 1st June 2007 in Geneva, the World Health Organization WHO signaled the urgent need for countries to provide a network of community mental health services at its Global Forum for Community Mental Health in Geneva, 30th to 31st May 2007. For the first time, WHO invited people living with mental disorders to attend the forum, sending a message to countries that it is important to give a voice to this excluded group to claim their rights and secure their participation in the society. Not only are the community mental health services more accessible to people living with severe mental health disabilities, they are also more effective in taking care of their needs compared to mental hospitals. Community mental health services are also likely to have less possibilities for neglect and violations of human rights, which are too often encountered in mental hospitals, said the director of WHO Mental Health and Substance Abuse. There are nearly 54 million people around the world with severe mental disorders such as schizophrenia and bipolar affective disorder, which is the manic depressive illness. In addition, 104 million people suffer from depression alone. People living in developing countries are disproportionately affected. Mental disorders are increasingly prevalent in developing countries. The consequence of persistent poverty-driven conditions, the demographic transition, conflicts in fragile states and natural disasters. At the same time, more than 50% of developing countries do not provide any care for persons with mental disorders in the community. These disorders bring significant hardships not only to those who suffer with them, but also to their caregivers, often the family, given the lack of mental health resources found in developing countries. As a result, 90% of people with epilepsy and more than 75% of people with major depressive disorder in developing countries are inadequately treated. The call for community mental health services is especially timely since, in spite of clear message from WHO in 2001, there are only a few countries who have made adequate progress in this area. Also, in many countries, closing of mental hospitals is not accompanied by the development of community services, leaving a service vacuum. This topic should matter to everyone because Far too many people with mental disorders do not receive any care. The immediate challenge for low income countries is to use primary healthcare settings, particularly through community approaches that use low cost, locally available resources to ensure appropriate care to such disorders. This has been observed by the Assistant Director General of WHO Cluster on Non-Communicable Diseases and Mental Health. The challenge is to enhance systems of care by taking effective local models and disseminating them throughout a country. The WHO Global Forum for Community Mental Health was about showcasing models which are providing effective in-delivery mental health care in resource-challenged situations, she added. The forum provided a foundation for sharing information, providing mutual support and a sense of belonging for users, families and providers, and all who are interested in shifting mental health care from long-term institutions to effective community-based care. Forum partners included non-governmental organizations, professional associations, and interested individuals. Prominent among them were Basic Needs, the Christopher Blind Mission, and the World Association for Psychosocial Rehabilitation. The UK Department of Health actively assisted in the forum, which was convened by WHO's Mental Health and Substance Abuse Department. Viable options available to communities to improve the lives of people living with mental disorders and exercise their rights to community level detection and treatment of mental disorders includes 1. Integrating mental health care within the primary healthcare system. 2. Rehabilitating long-stay mental hospital patients in the community. 3. Implementing anti-stigma programs for communities. 4. Initiating population-based effective prevention interventions. 5th, ensuring full participation and integration of people with mental disorders within the community. To implement these effective interventions, governments need to establish clear policies articulating these measures and then develop systematic plans with dedicated budget and agreed timelines. WHO provides technical support to developing countries to take these steps towards making community mental health care available within their countries. Let me talk to you about the Comprehensive Mental Health Action Plan 2013 to 2020. WHO's Comprehensive Mental Health Action Plan 2013 to 2020 was adopted by the 66th World Health Assembly. Dr. Margaret Chan, the WHO Director General, described the new Comprehensive Mental Health Action Plan 2013 to 2020 as a landmark achievement. It focuses international attention on a long neglected problem and is firmly rooted in the principles of human rights. The action plan calls for changes. It calls for a change in the attitudes that perpetuate stigma and discrimination that have isolated people since ancient times, and it calls for an expansion of services in order to promote greater efficiency in the use of resources. The four major objectives of the action plan are: 1. To strengthen effective leadership and governance for mental health. 2. To provide comprehensive, integrated and responsive mental health and social care services in community-based setting. 3. Implement strategies for promotion and prevention in mental health. 4. Strengthen information systems, evidence and research for mental health. Each of the 4 objectives is accompanied by 1 or 2 specific targets, which provide the basis for measurable collective action and achievement by member states towards global goals. A set of core indicators relating to these targets as well as other actions have been developed and are being collected via the Mental Health Atlas project on a periodic basis. Now, what is good mental health? Let me give you an introduction to good mental health in everyday life. Good mental health doesn't mean absence of diagnosable mental health problems, although good mental health is likely to develop protection against development of any such problems. Good mental health is characterized by a person's ability to fulfill all the key points that I am going to tell you now. Ability to learn, ability to feel, express and manage a range of positive or negative emotions, ability to form and maintain good relationships with others, ability to cope and manage with changes and uncertainty. Now, how to take care of mental health in everyday life? Everyone can take care of mental health of his or her own and other members of his or her family or other members of the society by taking care of a few points that I shall mention to you now. Getting a checkup done by mental health professionals, especially in case of some problem which persists. If you get diagnosed with some kind of mental illness, should pay regular visit to the mental health practitioners for checkup. Connecting yourself with some kind of mental health program to spread awareness about mental health among the members of your own society. In this case, a person can give your share of effort either as a volunteer, a fundraiser, as a trust or foundation, or by sharing your story of fight with mental illness to encourage others to fight with mental illness problems. Talk about one's feelings, eat well, drink sensibly, keep in touch with friends, family and other members of the society. Accept who you are. Keep yourself active and fit. Ask for help whenever required. Do something that you are good at or like to do. Care for others. Let me summarize. Mental health is being mentally well enough to cope with our daily life situations and uncertain changes in daily life. A mentally well-being person is well enough to make emotional and behavioral adjustments to cope with uncertain changes in life. Mental health problems are basically mental illness which affects a person's life badly. Neurotic disorders are more common as compared to psychotic disorders. Good mental health doesn't mean absence of diagnosable mental health problems, although good mental health is likely to develop protection against development of such many problems. Taking care of mental health in everyday's life is easy. Following a few steps can save one from mental illness. And these few steps are: talk about your feelings, eat well, drink sensibly, keep in touch with family, have social relations, have a social life, accept who you are, ask for help whenever required, do something that you are good at or you like to do, something like developing hobbies, and last but not the least, care for others.